kwenye uchaguzi pamoja.
Riwruok monywando jochiw thieth mopogore opogore obuogo chako ng'anyo tarik 14 dwe mar 7 higani poni piny owacho koyie keto tim winjruoge mane giyiere ni piny owacho owinjo timnegi. Twak margi kod jofwamb wa Nairobi gikoni piny owacho mar Kenya Kwanza nosingo ndike tich lakteche 20,000 gino mapok gineno nyaka sani ka gikoni kata mana budget manyicho som omenda manochwal ni thieth ne odok piny kipimo kod higa mokalo. Kikoten county ma Nakuru mondo mi mabuogo riembo iticha mohewo jochiw thieth 500 chakre tarik 1 mondo mi oduok lakteche ge tich kendo wetiyo kod yora goko e chenro mag thieth e county no.
The strike is on, and to tell our members that they should prepare, as well as Kenyans, that from the 14th day of July there will be no nurses, no clinic officers, no nutritionists, no pharmaceutical technologists, no public health officers, no laboratory officers in any of the public facilities across the country, because the Ministry of Health and the Council of Governors and the counties have refused to come to the table so that we can finish the negotiation and registration of collective bargaining agreements. In the current budget, we have seen a reduction in health budget of 5.6 billion. And we are wondering, instead of increment of the budget, and especially so that we can accommodate the employment of the 20,000 healthcare workers who are promised by the current regime, we are seeing a reduction. And we are wondering, how are we then going to move from universal health coverage to universal health care if we cannot be able to meet the financial obligation that would make it possible to ensure that we have adequate staffing?
We have also seen an unfortunate development in Nakuru County where health workers are being left off without providing a mechanism to address the gap they leave behind. While we don't support employment under hospital-based contracts, the county should consider absorbing all healthcare workers who now face imminent dismissal to ensure uninterrupted service delivery.